Hi, I'm Dr. Rita Kathawa, bariatric medicine specialist and founder of Michigan Weight Loss Institute.
And I'm Dr. Marissa Baca, a board-certified plastic surgeon at the Straith Clinic. And this is A New You by Us Too.
Today, we're here to continue to bring you the latest and newest information when it comes to treatment for weight and obesity issues and body contouring as well.
Yeah, we're here to basically follow you and help you through that journey and give you a little bit of guidance. So today we're going to be talking about what happens to your body after weight loss. How are some of the changes in your tissues manifested, and what does that look like? So I think to get started is the loose skin. And that's probably the main reason that people start to come to me after a large volume weight loss. They reached their goal, or they're at least close to reaching their goal from a weight loss standpoint, but then now they're just left with this loose skin all over their body that they didn't anticipate.
Yeah, I mean, patients work so hard to achieve weight loss, and they really want their effort to be reflected in their cosmetic appearance as well. So that's where you've been an incredible resource, and you've worked very closely with our patients to achieve that. So maybe you can help guide us a little bit about how to approach loose skin.
Yeah, absolutely. And I think it feels to patients sometimes almost like a step backward. You know, they've lost this weight, they've achieved their goal, but then now here's this hanging skin and they kind of don't know what to do with it. And I think one of the things to understand is that you can't exercise away loose skin. I think patients hear that from friends and family members a lot. Well, why don't you just go to the gym more and whatnot, and that skin will go away. And that's not true. We'll typically see some degree of skin snapback, some degree of retraction of the skin with weight loss as the volume is going down, but to some degree that reaches an end point. And then what you're left with is that loose skin that really the only alternative is surgical removal. And a lot of it has to do with the areas on the body. So areas on the body where skin is not as thick, they do not tend to snap back as well. So the main places that we see this, tummy, upper arms, inner thighs, breasts, and then sometimes kind of the upper back area as well. And that's where patients see kind of this distortion, this extra flap of skin that isn't what they've worked hard for.
Yeah, definitely. We see a lot of that. And I'm glad you mentioned the upper back, because a lot of times patients do maybe necessarily, they forget about that area until they're there and they notice all this extra skin.
Right.
Yeah.
Right.
Maybe you can comment a little bit about which areas and how they behave differently in terms of loose skin.
Definitely. So one of the ways to think about it too is that when it comes to weight fluctuations and what happens after massive weight loss, is it's a 3D process, right? So your abdomen, when you're at your heavier weight, is being expanded in all dimensions. And then as you lose weight and that kind of inner volume, that fatty volume is coming down, then it's sort of like a balloon deflating. So we have excess sometimes in the horizontal dimension. We have sometimes excess in the vertical dimension. And oftentimes we have excess traveling all the way around. And so it's important to really be evaluated by where the excess is coming from, where is that laxity, where is that folding over, so that you can communicate to your surgeon what your goals are, but then also your surgeon can tell you what they see and where the laxity is, and that kind of helps best tailor a plan for how to cut out that skin with surgery so that we can contour that body to the best of our ability.
Yeah, and sometimes that loose skin can get caught in belts and clothing. So there's many benefits to skin removal, not just necessarily just cosmetic, which is super important, but also functionality and fitting better in your clothing. And we see a lot of that.
We see a lot of that. And the other thing we see a lot too is sometimes patients feel that the excess, puffiness that they have, they wonder, is this more fat? Do I need to lose more weight when it's just the volume of the skin? And the volume of skin can be tremendous with weight loss. As it kind of bunches together and folds over, you have to buy larger clothing sizes. Maybe you're not as comfortable wearing certain contours of clothing because the skin gets in the way. It's just a problem for sure.
Dr. Baca, maybe you can coach us a little bit about your approach to minimizing and hiding scars from certain body contouring techniques, because your surgeon this is why you tailor a treatment plan, individualize it for the patient. The patient may tell you what they want, but ultimately you know where those scars are going to go and how to give the patient the best result. So maybe you can walk us through that a little bit.
And that's one of the inevitabilities with skin excision. Mm-hmm. When we have excess skin, we have to cut it out. We can't get away with cutting out skin without leaving a scar. Mm-hmm. But what we can do is try to make that scar heal as best as possible, and we can also try to conceal it in a place that's going to be less perceptible. So for example, when we're talking lower trunk recontouring, so tummy tucks and things like that, we're trying to hide the scar under underwear and bathing suit bottoms and things that you would normally be wearing. For upper body, we're going to try to hide things kind of under bra lines or bathing suit tops and things like that to try to minimize the appearance as much as possible. And then there are a lot of modalities that we look at for trying to get that scar to fade out over time so that it's less apparent, because that's the important discussion that you're having with your plastic surgeon when you're looking at your goals and what bothers you is, okay, well, if we're cutting out skin, we're going to have a scar here. Is that worth the trade-off of the better contour, not having the skin, but trading it off for the scar? And sometimes, especially when we can make that scar the least noticeable scar possible, then it becomes more beneficial.
And those are all services that you guys offer at the Strength Clinic: scar monitoring and lessening the appearance of scars and different treatments maybe.
Absolutely, absolutely. In the sense that, my goal with patients is comprehensive care. So I want to evaluate what they see as bothersome, come up with a surgical plan, but then that's not the end of it. After surgery, we're following healing, we're following scar formation. We want to make sure that everything is the best outcome we could imagine.
Beautiful. And in terms of different body areas, are we able to combine certain procedures together? Sometimes with massive weight loss, we have a couple of different areas that might need reconstruction, and maybe if we're able to combine them and minimize anesthesia time, or sometimes they can't be combined. So
yeah. So yes, definitely we can combine surgeries. A lot of times it depends on what are our priorities, and then also what is the recovery going to be like. So certain things are easier to combine than others from the sense of how you might heal. And then we also have to look at the body as a whole. Where do we have excess that needs to go away? Where do we need to add back volume? Because it's sort of a double-sided coin when it comes to massive weight loss. There is a deflation in some areas where normally, and a healthy, youthful body, we'd like to see a little bit more volume. Those places, sometimes like the face, sometimes the upper area of the breast or the breast itself, sometimes the hips or the buttock, and we maybe want to see volume go back in those places, but we want to get rid of that volume that we've accumulated as that loose skin has kind of dragged us down. So both taking away the skin, but maybe adding volume to places. And so sometimes those things work hand in hand. Maybe we need to do a little bit of fat transfer. Maybe we need to take away some of that skin and stubborn fat in one area, but we can use that fat to our advantage by transferring it to somewhere else, like the upper pole of the breast, like the face, to rebuild some of that volume where we've lost it. So a great part of planning and sort of the unique approach to planning in these patients is wanting to kind of time that so that we do some of those things at the same time so we can make use of that tissue, so to speak.
Definitely, yeah. So especially fat transfer, you mentioned, this seems to have picked up popularity in the past few years here. And there is more and more demand for that. So that's a service that is available at the Straith Clinic.
Yes, definitely. And so a lot of it depends on what volume we need, where we're going, what we're looking to enhance, and also what volume do you have to give. So some massive weight loss patients have lost a lot of weight, but still have maybe a stubborn pocket of fat here or there in a distribution that they don't like. So as part of the contouring, we're going to get rid of that fat. We're going to get rid of the excess skin, but then we're going to use that fat to put it in, again, the face, the breast, what have you. But some patients don't have that option. They've reached their weight loss goal, and for them, they really have almost no subcutaneous layer left. We don't have any fat that we can take for the graft. And so then maybe we're looking at other volume modalities like filler or like an implant if we're talking about the breast or things like that. But so making sure that you're having a detailed discussion with your plastic surgeon about all your goals is so important to make sure that we're coming up with the best plan for you and based on, what you're presenting with.
So when you're doing your consultations with the patient, you do take into account the graft tissue that would potentially be transferred to a different site. Can you maybe comment briefly on which areas are a little bit more stubborn or which areas need more volume versus others?
Yeah, and a lot of it has to do with genetics. So, some of us carry our weight in our stomach. Some of us carry our weight in our hips. Some of us carry our weight in our legs. And so a lot of it ends up being, where do you have the volume that's accessible for the transfer? There have been some studies that tried to look at, is the fat better from one spot or another, and maybe some mixed results on that.
Okay.
But oftentimes we don't necessarily have that luxury with the massive weight loss patient in choosing where to get our fat. We kind of have to get it where we can get it. But with processing and whatnot, then maybe we can put it into the face, into the breast, into the hips. Now, face typically requires less volume overall as compared to some of the other areas. So maybe that's an area that's a lot more accessible for many patients because we don't need as much fat to harvest to be able to make a difference in the face versus areas like the breast, the hip, the buttock, where the volume required to make that change is a little bit larger. So we need to have more donor sites. So it just becomes a question of, can we do that with what you're presenting us with?
Thank you for the wealth of information. I mean, the face, especially in the news, has been a topic of discussion with the Ozempic face and all that. We do hear a lot about that, and that is a concern for patients. Usually, sometimes the face is one of the first areas where you lose versus, the distribution goes everywhere, but because there's less fatty tissue in the face to begin with, it's more visible. So it's really good to hear
Definitely,
of all the options.
Well, and the face is somewhere a little harder to cover up, right? We have compression garments and body shaping wear that we can sometimes cover up, but the face is out there to everyone. And Ozempic face is something, that hit the media and everyone wanted to know, what is this? Is it just Ozempic? Is it just the medication? But really what Ozempic face gets at is rapid weight loss. So anyone that experiences rapid weight loss, whether that's via diet and exercise, whether it's with aid of medication, whether it's with bariatric surgery, they're going to see changes. And as we deflate that fatty volume and sometimes the muscular volume of our bodies, oftentimes when it happens in a very rapid fashion, the skin can't catch up with it. So then you see a little bit of skin sagging. Again, it's that deflated balloon. We're taking out the volume underneath, and then that balloon just kind of sags a little bit. So maybe we see it where we look more aged in our face sooner than we should, because a youthful face has volume to it. A youthful face is tight, is lifted, but it has volume to it. So as we lose that volume in our face, and then our face kind of starts to sag down, maybe we have more lines, maybe we have jowls, maybe we're even getting a little bit of laxity in our neck. That's where we start to see more of an aged look than maybe how old we feel. And so that's where volume can come into play or other surgical things. So it's not a phenomenon that's unique to Ozempic itself. It's just a phenomenon that happens with any kind of rapid weight loss.
Yeah, and that's why, we mentioned in our earlier sessions that dose of medicine is really important. Sometimes I have to back off. If someone's losing very rapidly, we have to maybe not necessarily take them off the medicine, but back off a little bit dose-wise, adjust their dose, because as you mentioned, you really don't want to lose that elasticity, the volume. With volume, we have collagen, we have muscle tissue, so we got to protect all that.
Yes.
And also that's where you come in to provide some of that volume and protect the youthfulness.
Right.
Youthful appearance.
Sometimes it's the marathon, not the sprint, right? Because you're thinking about all of those goals of preserving all the good components and not wanting those to go down too quickly. Absolutely.
And you can also coach our patients in how much weight loss is necessary to achieve maybe the surgical look they're looking for. Say they feel strongly that they want maybe remove certain tissue and transplant it somewhere else. So you're able to coach us on there's such a thing as too much weight loss.
Definitely.
For a cosmetic, from a cosmetic standpoint as well. So.
And sometimes patients see me at their initial consultation when they're still going through their weight loss journey. And I think that's a very reasonable thing to do and probably a good idea, especially for those of us out there who are planners and want to think more long term, because we can kind of catch them in the middle of it too and say, what are your goals? What are we looking for? What do we want to see with that? And then I think it just helps patients develop a long-term plan a little bit easier.
Definitely, yeah. Usually I involve Dr. Baca about midway, a little past that point, before the absolute end of our goal here. Once we start getting towards the end of our weight loss journey here, and she's been very helpful in coaching us on how much volume we need to transfer to other areas to achieve the cosmetic finish that they're looking for.
Absolutely. Well, we're so happy that you tuned in, and we hope you learned a little bit more about how your body might change when you experience a large volume weight loss or weight loss of any kind oftentimes.
And the surgical options that are available for you.
Yeah. So stay tuned for some future episodes where we dive more into surgical options. And as always, you can visit our social media or our website and see these links for more information. Thank you.